Hello, everyone, and welcome back to another Flawless Talk. I am Shelly Allhands with Flawless Foundation, and today we are joined by Dr. George Giuliani. Dr. Giuliani, I'm so happy to chat with you today, and I appreciate you taking the time to sit here and talk to us about National Counseling Awareness Month.
It's a pleasure to be here. Thank you. Thanks for having me.
So, National Counseling Awareness Month was established by the American Counseling Association, and the purpose is to celebrate both the counseling profession and the individuals who do this important work. So, with that being said, today we're going to be talking with Dr. Giuliani about the basics of language related to the broad word around counseling, the types of certifications and what they mean, as well as we'll be giving you some practical advice so that you can find a mental health professional who is a good fit and some other tidbits in there as well. And first, we'll jump right in, and I just want to introduce you to our guest, Dr. Giuliani. He is not only a New York State licensed psychologist and university professor and university chair, but he also holds a unique set of board certifications in child and adolescent psychopathology, special education, and forensic psychology. And we're lucky enough to call him a Flawless board member. So welcome again, George.
Thank you.
Now, you are probably familiar with this, but before we start, and for viewers who maybe aren't familiar with us, we like to start every conversation with the question, how are you really doing? Because so many times in passing, we ask people, how are you? And we don't really mean it. We just want to hear, oh, I'm fine, or I'm okay. But here at Flawless, and I know so many other people, we truly care about how the person is doing. So, Dr. Giuliani, how are you really doing today?
Oh, I think it's a wonderful question too. I'm doing really well. I'm thrilled to be here. Looking forward to talking with you, sharing this time together. Busy time of the year at the university right now with students, but also looking forward. I'm going to the NFL draft in a couple of weeks with my son, and I get to see him coming out from Arizona. But I feel refreshed. I'm ready to take on new opportunities, and I'm really appreciating the chance to connect with you today about what we're going to discuss. And I'm in a good place right now. So it's a pleasure to be here, and life is good right now.
That's amazing. That sounds really good and like a lot of fun coming up. We'll
Mhm.
all have to keep an eye on for you at the NFL draft.
Yes.
All right. So my first question then for you is the public often uses therapist, counselor, and psychologist interchangeably. And these questions can kind of help clarify who's who. So in the spirit of this awareness month, we do hear that especially counselor as the catch-all. But from your perspective as a licensed psychologist, how should the public differentiate between the counselor, social worker, psychologist, et cetera?
Yeah, I think it's a really good question to start with, like you said, in the spirit of Counseling Awareness Month. I think first it's really helpful to clarify that the word counselor is often used really broadly, but counseling has a very specific meaning depending on the setting in which you're in. So when you think of counseling, first off, counseling is a process of providing like guidance, support, education, or advice to help individuals, help them to make decisions, solve problems, develop skills, or really cope with challenges. And it can be informal, like you get guidance from a trusted adult, or it can be professional, such as therapy from a licensed mental health counselor. But at its core, when you think of counseling, it really involves four things. First, counseling involves listening very carefully. It's understanding a person's needs or concerns. It's offering guidance, strategies, or information. And it's also supporting decision making or showing for personal growth. Um, Now, the term counselor applies to many different roles. So for example, when I was a kid, we had camp counselors. When I was in
Oh,
high school, we had guidance counselors or what we'll call school counselors. If you've ever watched an episode of Law and Order, they say counselor, approach the bench. For lawyers, there are career counselors, mental health counselors, financial counselors. So that word counselor also takes on a very broad meaning.
I
And
never
I
even
think,
thought about all of those. You're
yeah,
right. I mean,
yeah,
across every aspect there.
every aspect of it. So as we're talking about Counseling Awareness Month, I think the first thing is that it's important to recognize that not all counselors provide mental health therapy, but all counselors share a common goal, and that's to guide and support other people, no matter what kind of counselor you are. Now, going back to your question, as a licensed psychologist, I often remind people that while the term therapist, counselor, psychologist, or social worker are sometimes used interchangeably, they represent very distinct professions with different training and roles. So first, when you talk about counselors, so someone who is a counselor, those people typically hold master's degrees. They're trained to provide talk therapy for life challenges, stress, relationship issues, and common mental health, concerns. When you think of clinical social workers, they also hold master's degrees, but their training emphasizes understanding individuals within like the family community or social systems. So they'll also provide therapy and helping clients connect, but also with community and resources and support services. Then we have psychologists, and psychologists will very often, if not all the time, hold doctoral degrees, what I'll call later as a PhD or a PsyD. And they'll receive extensive doctoral training in assessment, diagnosis, research, and treatment. And a key distinction for psychologists is that they're also trained to conduct psychological testing and evaluations in addition to providing therapy. And then finally, the last professional would be our psychiatrists. Now, psychiatrists go through medical school. These are medical doctors who specialize in mental health. These are the doctors who are uniquely trained to prescribe medications, manage psychiatric conditions from a medical perspective, and they'll often work collaboratively with therapists and psychologists to support comprehensive type of care. So
I think that's a good point you just made there about while these all have different specialties or different purposes, that they really work comprehensively together to offer full like mental health care for the client or person.
Right. So I think the thing to remember is that all of the professionals that I just mentioned, they all play important roles in mental health care. I mean, all of them. But rather than focusing only on the titles, what people should be aware of, what the public needs to be aware of, is looking at the licensure, the training, and the specialization to determine which professional would best meet their needs at any given time in life.
That's so important. Okay. So kind of on that same topic of language, recently there's been kind of a shift in schools from the title from guidance counselor to school counselor. Do you think you could explain the rationale for shift and change in terminology there?
Sure. So when you think of the shift from guidance counselor to school counselor, I won't go too in depth, but it'll make sense in that it really reflects how the role has expanded. It's really an expansion of the role. Because historically, guidance counselors, like when I went to school, they were primarily associated with academic scheduling, course selection, and even career planning, like going to college.
Oh yeah, I remember the career planning being a big part when I was in high school.
Huge part. And while those responsibilities still remain very important, they only now represent a small portion of the modern role of what we call the guidance counselor. A school counselor better reflects the comprehensive nature of the position today. So school counselors not only do everything I just said, but they support the students' academic, social, emotional, and career development. So they'll address concerns such as anxiety or peer relationships or crisis response and the overall student well-being. So the change in terminology, it really highlights that school counselors are trained professionals who support the whole child, not just the academic planning as they used to.
That's a lot. I don't think that school counselors are getting enough credit for all they offer.
They do so much. It never ends. Yes.
So maybe we could all go out today, or next time you go to your child's school or somehow come across them, just give them a pat on the back or say thank you.
There you go. Right. Exactly.
Okay, then kind of going back, still kind of on language, but talking, you could just explain the difference between the different types, between psychologist, social worker, all of that. So with those different practitioners, a lot of them have common, like there's initials after them. So, I think some of the common ones people might recognize are LMFT or an MSW, LCSW. You mentioned the PhD, or I think you said PsyD, and even the MD or DO. So could you just kind of briefly explain to the general public what those differentiate or mean?
Yeah, and I think you highlighted on the main ones first off, the ones you mentioned. So the first one, the LMFT. So that's a licensed marriage and family therapist. And so this is going to be a professional who specializes and has training in working with couples and families. It's a marriage and family therapist. Makes sense. And the LMFTs focus on relationship dynamics and family systems in terms of working with couples and families. And then you have the MSW, the Masters of Social Work. Now, the MSW is an academic degree rather than a license. So someone who has an MSW, that's a degree that you obtain. And an individual with an MSW may work in a social service type of setting, and they're going to complete supervised hours, but they have to pass a licensing exam to become an LCSW, which would be the licensed, okay? That's the L, the license component, in order to provide individual clinical therapy. So when you see the LCSW, that now indicates you've got a social worker, but who has completed the degree, the MSW, but now has the clinical experience and the license to be able to practice therapy. So LCSWs provide therapy, and they're also trained to consider environmental and social factors that affect mental health. So those are the licensed individuals who can give therapy, but with a master's degree.
So the MSW, would you say, not, of course, not across the whole board, but would those typically be more in that maybe offering like hospice social work care or dialysis, exactly. that kind of thing?
Correct. And that would be the degree, though. In order to practice, you need the L.
Okay.
Right. You need the L.
Right,
unless
so
you're under somebody's
important.
supervision. That L is very important. The L is very important. It's kind of like when I got my doctorate, that was nice. It's a nice piece of paper to have on the wall, but I was not allowed to practice. It was only when I became licensed.
Okay.
Only when I passed the licensing exam could I actually treat people.
Okay,
so when you
so
become
there's
a
lot of
doctor,
steps.
right? So once you become a doctor, you're not licensed to do anything yet. You then have to take exams to then become licensed to practice. Correct.
All that work, and you still have to go
all
and
that work. Right?
get more
Right.
licensure and paperwork.
Right. You get close to the moon, you're not landing on the moon. You got to get the license.
Great timing for the moon with everyone up there.
Exactly. Right.
Yeah.
Right. Okay. So now when you go to the next level, you're talking about the PhDs and the PsyDs. Okay. So the PhD is what we call the Doctor of Philosophy in Psychology. That's a doctoral degree, but it emphasizes clinical training and research. Okay, when you think of the PhD. So psychologists with a PhD are trained in assessment, diagnosis, therapy, and also scientific research methods. The other doctorate you'll see in the field is what's called the PsyD. And the PsyD is the Doctor of Psychology. And that's also a doctoral degree, but there's a much more stronger emphasis on clinical practice rather than research. So if you're deciding to go on and become a doctor in psychology, you could go for the PhD, which would be more research-based, or you could go for the PsyD, which is more clinical based. You're going to spend more time working with clients and being in clinics than you are maybe doing research. But ultimately, whether you see a PhD or a PsyD, if they're licensed to practice, they can practice in the field.
Okay. Wow. So the PsyD and then the
PhD.
PhD. Right. PhD was more of the research base.
More research based, correct.
Okay. So you would maybe see those more in like at university campuses.
The PhD.
The PhD, yeah.
The PhD you'd see at more university campuses. The PsyD you'll see doing more of therapy. But that doesn't mean a PsyD can't be a research. I'm a PsyD. I'm a PsyD, not a PhD. Oh. Yeah, so I have my Doctor of Psychology.
Okay, interesting. All right, I learn something new every day.
There you go. And then the last initial to be aware of, or initials, is the MD or the DO. The MD is the Doctor of Medicine. The DO is the Doctor of Osteopathy. But these are physicians, okay? These are licensed physicians. And in mental health, we talk about them as psychiatrists. Okay, so these are people who graduated from medical school and then went on to do a few years of residency in psychiatry. And these are the people who can prescribe medications. Like, even though I have a doctorate, I'm not allowed to prescribe anything. I have to work with the psychiatrist who can manage the psychiatric conditions medically, and then they'll collaborate with me in order to determine the right treatment in terms of whether you want an antidepressant medication or anti-anxiety medication, etc. Okay. So those are your initials.
So again, everyone's got their part in there to make this all go around.
Exactly.
for the
Exactly.
comprehensive care.
Yep.
Okay, I think that helps me understand, and hopefully our audience understands a little bit more of all those different pieces there. So, with all of that you've just kind of explained about the differences, I know a lot of times if you're looking for a provider or some sort of mental health, I mean any actually doctor or provider, your insurance typically has a list of directory you can sort through. There are a lot to go through.
Right.
So, what are maybe some things that someone could look to help narrow their choices when they could get overwhelmed?
Yeah. And first off, the word overwhelmed when looking for mental health providers is a
Oh,
fair word. If you ever say to your insurance company, send me a list of the mental health providers, you will get pages upon pages upon pages with different initials and so many things. And so it really can feel overwhelming. And I've helped a number of people narrow down who to look for based on some like a few key factors that can make the process more manageable
okay.
and help you find a good match for you.
Because the way
So,
you pointed that out, being overwhelmed while looking for a mental health professional
yeah,
may not
right,
always be the
right. So kind
manageable
of
is
an
what we want.
oxymoron, right? With things. So the first thing you want to do in all cases is you always want to review the provider's license and credentials.
Okay.
That's number one, because this will give you insight immediately into their training and the types of services that they're qualified to offer or not qualified to offer. Then the second thing is you look for an area of specialization.
Okay.
See, many providers list specific issues they commonly treat, such as they'll tell you, I treat anxiety, depression, trauma, grief, relationship challenges, substance abuse, whatever that might be. So selecting a provider with experience in your particular concern increases the likelihood of a successful treatment. If you think about it, this is a silly example, but it'll make sense. I could, if I'm having heart related issues, if I find the best orthopedic surgeon, that's going to do me no good because the orthopedist is focusing on orthopedics and my knee, but I'm having problems with my heart.
That
My
is, I
knees.
love that example.
Yeah. So when you're looking for someone, you want to know, what do they focus on? What is their area of specialization? And then the third thing to look for is also, what about the populations they serve?
Oh,
So, for example, you could find the best psychologist, but if they don't focus on children and adolescents, and you're looking for someone to help your 9-year-old, that's not going to do you any good with things. It's
minor
the same
detail.
thing if you have a really great child psychologist and you're looking for someone who takes Medicare because you're 72 years old. You want
Mm,
someone who does geriatric
right.
psychology. So choosing someone who regularly works with your age group or situation also plays a very meaningful role in terms of who you choose.
Yeah, those are great,
Right,
great things to look for.
right,
And
right.
I have a follow-up question on that.
Yes.
Okay, so maybe now they've been able to manage the list. They've maybe picked a provider to do an intro intake. What are maybe some questions that they should ask or things to look for during this consultation to ensure that the fit is right?
Right. Okay. Couple of things first in terms of what that would look like. It's very important that you realize that when you're trying to find a therapist, it really has to be a good fit for you. It's got to be a good personal fit and professional fit.
Mhm.
Because beyond the credentials, right? Beyond all the credentials, clients should feel very comfortable asking questions and paying attention to how the interaction is going between them. So,
Mhm.
for instance, here are some questions I always like to let people know when you go meet with a therapist. Here's what you should really ask. First, what experience do you have working with concerns like I'm bringing up? Okay, so this will help you determine whether this provider has treated issues similar to yours. If you've got anxiety, what experience do you have working with anxiety? If you're suffering from trauma, death of a loved one, if you're suffering from trauma of some specific nature, what experience do you have in this field and how long have you been doing it? That's
Yeah,
very important.
very.
Second, what's your approach? What's your approach to treatment?
I
Like,
like
tell me
that.
about your style. What methods do you use? How do you give therapy? What does it look like? And does that align then with what I'm looking for too?
Mhm.
What's your approach? Some people, some psychologists like myself, I'm available to people all the time. They've got my cell phone, they can reach me, they can text me. As I always say, mental health has no holiday. You you know, but I know other therapists where no, I'm in the office a certain time, and
Mhm.
you know, we have our session, but we talk when we talk, kind of thing.
Yeah.
That may work for some people. It may not.
It's interesting. So when you say that, in the past, when I have looked for therapists, I've come across some who, during the session, will ask a lot of questions, and then others who kind of sit back and are just like very quiet. And so, I think that was something for me that I found which one,
Yep.
worked better for me. They're very different. Sometimes you can
Mhm.
just be like, just sitting here, not really sure what to say. Maybe you need more guidance, or
Yep.
maybe you just need the room to,
Exactly.
share as you want.
And it's so true because some people want interaction, they want the back and forth, and some people want to do most of the talking.
Hmm.
You know, another question that's really important, especially if you've never done therapy before or been in therapy. What's involved in the process? How often are we going to have sessions? How long are our sessions? And how long do you feel based on what I'm going through? Do you think I'm going to need therapy?
That's very important.
Like how long is this process going to be?
Yeah.
And how do you communicate with me outside of therapy with things? So, do we just meet and that's it? Or do I have homework? Do I have things to do? Do I
Mm,
email you? Am I texting you? What does the whole process look like?
right.
You know?
That's very important. Yeah.
Right. Right. And then one other question I always think is very important is what do you need to know about scheduling, cancellation,
Mm,
fees? How does that all work? There's a practical nature of therapy
right.
because therapy still is for the therapist. It's still a business. It's
Hmm.
still, and so who submits the insurance forms? Do you take my insurance? Things today that we weren't talking about. Do you accept Venmo? Do you accept credit card? Do you pay at the end of each session? Do I give you a check at the end of the month? I don't know.
Right. Right.
I
No,
mean,
it's so important.
these
I
are
just,
all practical things. And what if I have to cancel 2 hours before? What if I
hmm
get sick? Is there a cancellation fee? Do you have to pay? Is there a
hmm
24-hour cancellation fee? Like these things are the practical nature of therapy that are good things to know. So, you know, look, the most important element when you meet with a therapist, of course, is comfort level.
hmm
There's got to be a comfort level. Feeling
right.
heard, right? Feeling respected and understood is a strong indicator of a really good match.
Hmm.
There also has to be the practical relevance of, can you meet my needs based on the questions that I just raised?
Someone once explained it to me as like dating.
Hmm.
That sometimes you can,
Oh, yeah.
go on multiple dates with
Hmm.
different ones till you find someone that you're comfortable with or have a good fit with.
And so true in terms of you're sitting across from someone because you always have to remember if you're meeting me for the first time as the client,
Hmm.
I'm screening you too as the
It's true.
therapist. I'm
Right.
screening to see whether or not you'll be a good fit for me to work with. Not
Right.
just you may want to work with me, but I maybe look at you and go, you know what? I don't think we're going to be a good fit. I don't
Right.
think it's going to match well. Or I don't think my skill set, I
Hmm.
don't think my knowledge, skills, and abilities will work for you. You may like me, but I don't know if I'm qualified
Right.
to work with the issues that you're facing.
That's
So
probably
let me
so
give you a
helpful
referral. Yeah.
for, the provider to be able to say that, to
Yes.
give that feedback.
Hmm.
Um,
Yeah.
so yeah, that's super helpful.
Hmm.
Well, I have a question that you just made me think of when we were talking about some of those things. During COVID, I feel like a lot of mental health sessions, therapy sessions turned into telehealth.
Yes.
I'm kind of interested. Do you think that, have you seen a shift now? Is it gone back to more in person? Is it really just depending on the
It's
provider
a
and the
great
client?
question, Shelley. It's such a great question. You know, COVID was awful. COVID was the worst of the worst times.
Hmm.
If there was anything good though that came from COVID, anything out of an awful time,
Hmm.
what was good that came out of COVID was the ability to have telehealth. The ability for people to now be able to do what you and I are doing right now.
Hmm.
You have to remember 10 years ago the word Zoom that didn't mean anything. Now it's a verb. By
Oh
the way,
my gosh, yeah.
you know something is successful if it becomes a verb. Like you Google.
I know,
Like
I was
Google
thinking
is a
Google.
company until you Google. Now we Google things. When your company becomes a verb, you know you've made it. I'll Amazon it, right? Let's Amazon it, right? So I always say when your company becomes a verb, that's when you know. Okay.
I'm going to
So
take that now and use
so
that.
what's wonderful now with telehealth is the ability for people to come when they often couldn't. So
Mm-hmm.
for example, your child is sick, but you want a session. We can telehealth
Mm-hmm.
with things. If you can't make it on a given day, We can telehealth. Now, there are negatives to telehealth too. There's no
Okay.
question being in person is much, much more effective than doing it like this. It is.
Okay. Is it just because you can read body language or
Yes,
what? Okay. Okay.
body language, also confidentiality,
Mm-hmm.
also the quiet, the time to reflect, and just look. Think of it in terms of, you mentioned the date, right?
Mm-hmm.
Eating lunch with you on Zoom is not the same as eating lunch with you at a restaurant.
That's very
You know,
true. Like it's nice and it's
it's just
helpful.
not.
It's you know,
It's right.
but
We could eat lunch together right now, like this, but it's not the same.
mhm.
But it is very, very convenient with
Yeah.
things. So I would say from my practice, it's probably now 50-50. It's probably
Okay.
50% I know for many psychologists and psychiatrists, they're all telehealth now. They
Mm-hmm.
never went back. They
Mm-hmm.
never went back. Yeah.
Interesting.
Especially
Yeah.
psychiatry. I've seen a lot of psychiatrists not go back.
Huh.
Right.
Okay.
Yes.
Interesting. I could probably ask you all sorts of questions, maybe another time of
Right.
like,
Right.
why that is or
Right.
anything.
And I'll
But
tell you one other thing that's interesting.
yeah.
Telehealth with adults is fine. It's fine. I can do it.
Um,
Telehealth with children and adolescents, no, no.
okay.
It's
That makes
it's
so much
doing it.
sense.
Working with a kid in a Zoom box is not working. It's
That's
just
fair.
not.
On
They're,
both sides, I imagine.
yes, on both sides. On both
Yeah.
sides. Yes. Mhm.
Yeah. So again, like I think that goes back to, like who is seeking the help, what kind of help you're seeking,
Exactly.
all of
Right.
that.
Because
Okay.
people will call me and say, I'm in New York City, and I'm on Long Island. Do you
Mm-hmm.
do telehealth?
Mm-hmm.
Do you do telehealth? Right.
Okay.
Right.
Makes a lot of sense.
Mhm.
Okay, I'm going to jump in. So I know we talked about some acronyms, so not to bring up more acronyms, but
Sure. Mhm.
within looking for a specific type of provider or counselor, they'll a lot of times you'll run into those acronyms. So you could look for maybe you'd see CBT, DBT, EMDR.
Mhm.
So with again,
Right.
not getting too technical,
Right.
could you explain the language of these different approaches to someone
Yeah.
who just wants to know, will
Right.
this help me feel better?
Right. Okay. So first off, just like with all the different providers, when people are searching for a therapist, a counselor, the acronyms, like you said, CBT, DBT, EMDR,
Mm-hmm.
that can feel also very confusing or intimidating.
Mm-hmm.
And I tell people, you think of these terms like they're like tools or roadmaps
Mm-hmm.
that the therapist is going to use to help you try to feel better, rather than something they need to fully understand before starting therapy.
Mm-hmm.
So I'll give you like the three you mentioned because I could
Okay.
talk about 100 of them. So first, CBT. All right, that's cognitive behavioral therapy.
Okay.
Okay, and that is going to focus on the connection between your thoughts, your feelings, and behaviors.
Okay.
So what it's going to do is CBT is going to help identify unhelpful thinking patterns that you're having, and I'm going to teach you practical skills to change those patterns of thinking. So
Okay.
many people will find CBT very helpful for concerns like anxiety, depression, stress, and
Mm-hmm.
managing negative thought patterns. Like
Okay.
if they loop in negativity, and I want to change their way of thinking and how they think about it.
Mm-hmm. I like that you're like changing the brain in there a little
It's
bit.
exactly right. Now, DBT is the abbreviation for what's called dialectical behavior therapy.
Okay.
Now, this is a type of therapy that is going to emphasize skills for managing more intense emotions, more intense, improving relationships and coping with distress. This is very helpful for people who feel overwhelmed by emotion, overwhelmed
Mm-hmm.
by their feelings, and they struggle with what we call emotional regulation. They can't
Ah,
get their regular. So when you hear people going for DBT, they
okay.
often have great difficulty getting their emotional regulation under
Mm-hmm.
control.
It's interesting. I feel like that's a very common phrase that we all, talk about,
Mhm.
even with, like raising children now about our
Children,
own emotional
right?
regulation. So
Emotional regulation,
interesting that
right?
it's in there too.
Right. And then the last one you brought up was EMDR. And
Mm-hmm.
that is an abbreviation for eye movement desensitization reprocessing. Long,
Woo,
long phrase.
okay.
But
So,
but it's an approach commonly used. We really use it to help people process trauma,
okay.
traumatic or really distressing memories. And
Okay.
what it does is it helps the brain reprocess difficult experiences so they feel less overwhelming over time. So people who have been through significant trauma will
Mm-hmm.
often go through EMDR. But
Okay.
the million dollar question in all of this is really, is this going to help me feel better?
Right.
The most important takeaway is that everything I just mentioned to you are evidence-based methods.
Okay.
They've been shown to help people. The research has shown it. Now,
Hmm.
no single method works for everyone.
Right.
It just
Everyone's
doesn't.
different
Right.
experiences. Yeah.
Right. So what's going to matter to you as a potential client working with a provider is who can explain their approach to you in a very clear, understandable language and adjust their methods to meet your specific needs.
I
That's what it
think
comes down to.
that's perfect. Like mic drop, done. Like
Right.
that, I think is so great.
Right. Right.
Um,
So
I,
ask the question. Here's the question to ask.
okay.
How does your approach help someone with concerns like mine?
Okay.
I mean,
Yeah.
you just heard my story.
Yeah.
You just heard your story, I'm saying. So
Right.
and now you're going to say, so knowing what you know now,
Hmm.
how is what you do, how is your approach as a therapist going to help me with my concerns? And a
Right.
really good clinician should be able to answer that question in a very clear, practical, and reassuring manner.
I love that you mentioned the evidence-based and research-backed.
Yes,
I
all of
mentioned
them.
that's
Correct.
you had mentioned adolescence earlier, and this just popped into my head. Could you also maybe explain play therapy? I think I've heard of that one with kids.
Yeah, one of the things that you have to know with kids. And just so you know, my background, I first started off, got my degree in school psychology. So I started
Oh,
off. So I'm also a New York State certified school psychologist.
okay, because you didn't have
And
enough degrees.
right, right. So one of the things which will not shock you is that most of the time a 6-year-old is not going to sit down on your couch and just start articulating all their feelings and emotions. It
Right?
doesn't really work that way.
Right.
But what you can do with a 6-year-old is you
Hmm.
can sit down and play a game of Sorry or Battleship or
Okay.
Monopoly or Candyland, depending on level. And
Uh-huh.
while we're playing, we can talk and we can
Oh,
talk about your feelings and emotions. Or I might have games because
okay.
kids will talk when they play games. And so
Mm,
play therapy is exactly what it sounds like. I'm
okay.
going to give therapy, but we're going to play while we
Okay.
do it. Now, how we do it can be different for each kid.
Hmm.
When I work with teenage boys who are like, 11 or 12, I have an 80-inch screen TV with
No way.
Xbox. Oh, yeah.
That's you're meeting
Oh,
the client where they
I,
are and who
I
they are.
am, let me tell you, I am phenomenal at Madden. You do not want to take me on at Madden and NBA 2K. I will win.
Oh, wow.
I am, but a kid, a teenage boy or a pre-adolescent will talk more with a controller in his hand
Right.
because when he's talking, he doesn't have to look at you. And that eye
Oh, okay.
contact can be very difficult for a fifth grader.
Yeah.
But but again, we can talk. And sometimes you're thinking, I don't know if I'm making any headway. And then the kid will leave and tell his parents, that was the greatest session ever. That was so great. And they
Right.
talk. Whatever works, Shelley. That's
Yeah.
the thing. There's no magic approach.
Yeah.
If you ask therapists, what's my approach?
Hmm.
Many of them will tell you, I'm eclectic. And
Okay.
eclectic is just code for every person that comes in is unique. And
Okay.
I'm going to do what works for that person.
That's
I'm
so
going to do
important because it's not a one box
right.
or, one thing fits all.
No,
Everyone's
it
unique.
absolutely doesn't.
Yeah.
Absolutely doesn't.
All
Yeah.
right. That's so great. Interesting. So when I think about play therapy, I didn't even think about, meeting someone at video games, but
Meet them
that
at their
makes
level.
sense where they might
Meet,
open up or feel more comfortable.
meet them at their level, whatever it takes. Yes.
Okay. So, all right, I'm done now with your technical questions. I just wanted
Okay.
to finish up with just a couple interesting thoughts from you. So,
Sure.
as a university professor, you're training this next generation. What is one thing that you're teaching your students today that wasn't part of the conversation maybe 20 years ago?
I could probably spend 10 hours on that question. So,
Okay.
so I'm going to answer this a little bit differently because of our conversation. So I'm
Okay.
currently in the School of Education. So I teach the people who are becoming special education teachers, and I teach them the course on assessment and diagnosis, or I'll teach them the course on children with emotional or behavioral concerns or something.
Hmm.
But if I were teaching in the Department of Psychology or the future mental health, if I was teaching a
Hmm.
social work program or
Okay.
psychologist, something that was not emphasized in my training that I would clearly that is being emphasized today is that seeking help for mental health should carry no stigma. And mental health is just as important as physical health.
Hmm.
Years ago, back when I went to school, conversations about mental health were often, they were quiet, they were private. And when I was growing up as a kid, it was kept in the family. It was always
Okay.
kept in the family.
Yeah.
Many people were reluctant to seek help because of fear, because of shame, or the
Mm,
belief that struggling emotionally was some sign of weakness
hmm.
in some way. And today, what is being stressed to students is that asking for help is a sign of strength. It's actually a sign of self-awareness and
Hmm.
responsibility and not a weakness. And we need to approach mental health in the same way we approach physical health, same exact
Yeah.
way. We
Yeah.
encourage people when they're in physical pain to go to a physician. If they're
Right.
ill, go to a physician. Get the help that you need. It should be no different if you're experiencing anxiety, stress, or feeling overwhelmed.
It seems so
Because,
simple the way you put it there, but it's so
right,
important.
right. Because mental health is health and
Hmm.
it deserves the same level of attention, the same level of care, same level of prevention in a
Hmm.
sense.
Yeah.
So what we're seeing with students today is that they're advocates, both in their professional roles and their communities,
Hmm.
normalizing the conversations about mental health. We
Hmm.
want to treat now mental health care as routine and essential, no different than medical care. Reduce the stigma, make it easier for people to seek the support that they need, and really do it without hesitation, do it without any shame whatsoever.
Yeah. I think that the shame, I think, is such a good word to like, let's knock that out. And hopefully, I mean, I'm hoping over the last 20 years since you've, been in this field, or I mean, I don't actually, maybe longer, but since you've been in the field, I would assume you think like you've seen a difference in this changing conversation and how people approach it. Like, do you think?
Tremendous shift since COVID in particular.
Oh, okay.
Tremendous shift because so many people during COVID and post COVID really went through difficult times for anxiety,
Hmm.
depression, stress,
Right.
losing their jobs, finances. And so the idea of now going to talk with a psychologist, talking with someone about their issues and problems doesn't carry nearly the stigma post COVID. It's,
Wow.
it's, I can speak on Long Island for that.
Yeah.
I might not be able to speak for the rest of the country,
Right.
but I can certainly say that there's much more of an awareness of the need for that level of health. Same
Interesting.
thing,
What a
by the way, with
shift.
medication. Same thing with
Mm.
psychiatric medication as
I
well.
feel like I've seen that even in like day to day, life of how people talk about medication, that it's
Hmm.
it's
Yeah.
not trying to like hide it, or
Hmm.
that it's
Yep.
okay, that you're on
Right.
it.
Right. Yeah.
um, okay. I love that. So to tie everything back into National Counseling Awareness Month,
Hmm.
what is one thing you wish, like one change, how people could view mental health professionals differently? Like, what would that be?
Okay. So if there was just one, so if the
Just one.
public could walk away with one thing from National Counseling Awareness Month, I think it would be a shift in perspective. A shift in perspective. I would hope it's this, that mental health professionals, no matter whom you choose, mental health professionals, we're not only here for times of crisis, we're here for resources for maintaining overall wellness, just like medical providers are for physical health. See, many people believe that counseling is necessary only when things become overwhelming, only
Mm-hmm.
when they cross there. And what I would really like to see the public be aware of is that mental health professionals, we're approachable partners who can help you with everyday stress, major life transitions, your relationships, personal development, not just when it crosses the line into serious issues. And,
Mm-hmm.
and I would want people to better understand that we are professionals. We're well trained. We're competent. We're qualified. We're caring. And
Mm-hmm.
we're dedicated to supporting really healthy coping, resilience, and emotional well being. And
Yeah.
so seeking counseling in any form should be viewed as just a normal part of self care. Because if
Mm-hmm.
there's one thing I know, we certainly don't do a good job of self care. We spend a lot of time taking care of other people and a lot of time worrying about other people. But our
Mm-hmm.
self care, we need to do just a better job of it all. So I would hope for a shift of mindset that viewing mental health professionals as not a last option, but as
Mm-hmm.
kind of a proactive, valuable part of staying healthy
I like the
overall.
proactive. It
Yeah.
doesn't just have to be reactive.
Mhm.
Yeah, I love that
Yeah.
word there. Um, okay. And then to finish it off with how we are at Flawless Foundation. So we believe, in this like concept of a flawless world and we want to get there. So
Mhm.
in an ideal type of society, what would a flawless world look like to you? And what is giving you hope right now?
Yeah. Well, I would say in a flawless world, if I tie it all back to everything we've talked about, I would envision, I would hope and envision a society where mental health is valued just as much as physical health.
Okay.
I would say, and that seeking help is seen as a normal and really responsible part of caring for yourself.
Mm,
And in that kind of world where your mental health is valued just as much as your physical health, we would all feel safe discussing our struggles
hmm.
without fear of judgment. And the support would be available early before the problems become overwhelming. It's that old line of teach someone to swim, not save them from drowning. You know,
Yeah,
the
yeah.
idea is I'd rather teach you how to swim than save you from drowning. So I would love to see a world where mental health services would be accessible and affordable to everyone, regardless of your background or your circumstances. So schools and workplaces and communities would actively promote wellness, prevention, and strong social connections. Really recognizing that our emotional well being is essential to our overall health.
Hmm.
As for the hope part, the hope, um, my hope is that there's growing openness about mental health. I mean, we're definitely better than where we
Hmm.
were. More people are definitely willing to talk about their experiences,
Hmm.
seek support, and encourage others to do the same. They are.
Yeah.
And I'm really encouraged by students and future professionals entering the field. They bring a lot of energy, they bring great compassion, and they have a strong desire, I can see it, to reduce the stigma and expand access to care. So maybe a flawless world may not be fully achievable, but I know that increased awareness,
Hmm.
acceptance, a commitment
Yeah.
to mental health, it gives me real optimism. That's
So
what it does about
y-
the direction we're heading.
your goal sounds feasible there. That
Yeah,
your
thank you.
flawless world there, like that
Yeah,
concept, that sounds feasible. I feel like we
there you
should be
go.
working towards that, and hopefully,
That's
like
it.
you said, we are seeing changes, and hopefully, we can just keep moving forward in that direction.
Yep, exactly.
Um, so is there anything else you want to add, or you think are we did I
I did a great job. You
yeah,
did, you covered a significant amount, and it was a pleasure talking with you.
yeah, thank you so much, Dr. Giuliani, for
You're
joining
welcome.
us and giving us all of that insight and breaking down the acronyms and the different types of counselors, from school counselors to
Mhm.
PsyDs
Mhm.
to even, camp counselors. I never even thought
Yeah,
about, how
yeah.
varying that word can be. So thanks for sharing your expertise with us today. And I hope you
My
all
pleasure.
learned something from this conversation.
Mhm. It was a pleasure being here. Have a nice day.
You too.